Today I will be discussing what to expect when undergoing repair of ectropion or entropion due to aging alone. As mentioned earlier, the procedure can usually be performed in the office as a same-day procedure. A numbing injection, similar to what you might receive at the dentist, is performed on the affected eyelid. An incision is made at the outer corner of the eye, which will allow the surgeon to tighten the lower eyelid by shortening it and placing dissolvable stitches. Additional stitches may be placed in the center or inner part of the eyelid as needed. After the procedure, the patient may experience some soreness in the outer corner of the eye for a few days. This can usually be controlled with over-the-counter pain medications such as acetaminophen. The patient is usually out of commission for 2 days, the day of the procedure and the day after. After that, the patient can return to normal life, but should avoid exercise and heavy lifting for about a week. The area will bruise and swell. This can be covered with sunglasses or with makeup. Risks of surgery include bleeding and infection anytime you have surgery on the body. There's a 1 in 10,000 chance the patient can lose vision from the surgery. It's probably riskier crossing the street, but we do it. And finally, there's about a 5% chance that the patient may need a revision down the road. However, the vast majority of patients who undergo these treatments report greatly improved quality of life after having them done.